Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room. I'm also the creator of the Mobile MD Kit, and I will be officially launching my other product that you might be aware of Thursday, July 30th, 12 noon Central Time. And I'm here with a series I might start titled Lessons from the Last Shift. So you know, I'm an emergency medicine doctor. I started being one 20 years ago. And I'm about to go on another shift tomorrow. And I'm reflecting on the last shift that I worked to hopefully provide you guys with some lessons that will help keep you out of the ER, especially during this pandemic. No one wants to be in the ER if they do not have to be. And welcome to the first person to show up for the live. Thank you so much. Definitely make yourself known in the comments as I share some lessons from my last ER shift. Now also, whoever you are, definitely, of course, comment, share, start a watch party. Definitely hit like and hit share. Thank you so much for coming in. And it's the weekend. It's the weekend. People let their guard down. They're not as careful. And things can happen. And I want to share some of this information with you. So I'm going to start my own watch party because I really need to get this message out. Okay, so let's take a minute and so I can share. Hopefully you'll join me in sharing. Okay, let's see. The people who share with me all day long, I'm going to share this video with them, because we really need to stay out of the ER if at all possible. So thank you so much. Who is that? Yeah, definitely. You got a really cute thumbnail there. Come on in and comment. So again, who am I? I'm Dr. Kadisha, your board certified emergency medicine physician, concierge physician, emergency medicine physician, author of the best-selling book, Help Us Help You in the ER, and creator of the Mobile MD Kit, here with lessons from my last shift. So my last shift was kind of, it was really busy, and there was like a theme. There was a theme to the shift. And one thing that ER people like to say is that things happen in threes during a shift. We have our little superstitions or whatever. So one of the themes was lacerations. I had to sew lacerations or cuts, deep cuts. I had to put stitches and cuts for about 4 people. And the first person for whom I had to place stitches had been doing work around the house, working on a toilet tank barefoot. Okay, working on a toilet tank barefoot. The toilet tank fell, it shattered into very sharp fragments, and he sustained a very large cut across the top of off of one of his feet. And I think it maybe took about 13 stitches to close it. Okay, so that's one lesson. If you are working around objects that are sharp, or that could break into very sharp pieces, objects that are heavy, anything that could fall, don't do it barefoot. Wear closed-toed shoes and be very careful. So that was lesson number 1. Hey, is it Ramisha or Ramicia? Thank you so much. That's a really pretty name. Thank you. So that's lesson number 1. If you're working around sharp, heavy objects or machinery, mowing the lawn, things like that, don't do it barefoot. Don't do it in flip-flops or things like that. That's lesson number 1. Lesson number two. Let's see. If you are getting yourself entangled in a physical altercation with your lover and they make biting motions towards you, disengage. Disengage, disengage, disengage. You do not really want to be bitten by anyone. I know they talk about love bites, things like that. No, you don't want to be bitten by anyone, lover or otherwise. I had a person whose boyfriend bit her hand. And human bites are very dirty. They might even be dirtier than dog bites. And our hands and feet are distal, the distal parts of our bodies, distal meaning far from this area. So the feet, hands, all of that. Those areas don't get the best blood flow. And that means that they are more prone to infection because they don't get the kind of blood flow that other parts of our body get, like our faces or our scalps, that can quickly wash away bacteria and things like that that could cause infection. So bites to the hand, if you're fighting with your lover, even wrestling, playfully fighting, tussling, things like that, and they get a little eager with the biting, disengage, because human bites are very dirty and they're prone to infection. You might end up admitted to the hospital with IV antibiotics from a simple human bite. So that's lesson number 2. Lesson number 3. If you are feeding your dogs and you have a small child nearby, or if you're feeling a little playful yourself, don't play with your dogs during feeding time. While you're feeding dogs, don't play with them. Don't let little children get in and play with the dogs or touch the dogs or pet the dogs during feeding time. Your dogs might take that as some kind of affront, or as you trying to take food away from them, and they might not even really be mad at you, but they might give you a playful nip. And based on how sharp their teeth are, that could mean taking a chunk of skin out of your hand or your forearm, similar to taking a bite out of an apple, causing what they call a skin avulsion. So that's like when you take a chunk of skin out and there are no edges to sew up because that piece of skin is just gone. Now, another thing that I'll warn you about, like I said, human bites to the hands and feet and all that, just human bites in general, they tend to be dirty. We don't like to sew those up because of their tendency toward infection. Completely closed wounds are even more prone to infection if they are dirty. So avoid bites from friends, lovers, whatever. Even if you're in an altercation and you want to do the most in an altercation, if someone acts like they're going to bite you, disengage, because it'll be a lot more costly than knowing that you lost that altercation. And having your toddler kind of sneak in while you're feeding dogs and try to take a piece of dog food out of the bowl could cause trauma to your child. And I had to deal with a toddler whose one of daddy's dogs took a little chunk out of her forearm. And since it was a dirty wound, all I could do was clean it. Hey, Victoria, thank you so much for coming on. Fitzgerald, thank you again for being the first person. So we can't always clean those wounds. So again, keep small children away from your pets at feeding time, because that could easily lead to a bite. Okay, so let's see. Lesson number 4. So if you guys could put the other lessons in the chat, that would be great. I think number 1 was do not work with heavy objects or objects that could shatter into sharp pieces while wearing open-toed shoes or being barefoot. That was my first laceration of the day that needed about 13 stitches. That's lesson number 1. Lesson number 2 is if you are engaged with someone, in some kind of altercation, or if you are, even playfully tussling with someone and they start to make biting motions toward you, or if they start to sink their teeth into your skin, disengage, because human bite wounds can be dirtier than dog bite wounds, and typically we are bitten on our legs or our hands, forearms, things like that, and those areas are prone to infection. So that's what number is that? Number 2 or number 3? So if you guys could put it in there. Okay, I think so. Lesson number 4 is if you injure your hand, if you slam your hand in a car door, in a truck door, or whatever, if you're using a hammer and you accidentally, strike a finger or your hand with a hammer, or, any kind of heavy object, if there's any kind of crush injury to the hand, remove all rings immediately. Remove all rings immediately, because your hand is prone to swell, and it might be impossible to get that ring off. It could be very uncomfortable, or even worse, the swelling and the placement of the ring could compromise blood flow to that particular finger, and based on how tight things are, or how long you wait, or how long it takes us to get the ring cutter, you might lose enough circulation to your finger such that it is no longer viable. So I had a patient who was at her pickup truck getting in or out, accidentally slammed her hand or a finger in the car door while she was wearing a ring. She didn't take the ring off, and her finger started to swell significantly with that ring on it, and she came into the ER freaking out because her finger was starting to become cold, numb, tingling. It was turning blue, and she was afraid she was going to lose her finger. So I think that is lesson number 4. So if you could definitely, if you can remember any of the lessons, definitely put them into the chat. And let's see, lesson number 5. And lesson number 5, I'll make that the final lesson, is if you're having chest pain, or if you've had chest pain or shortness of breath for any period of time, do get it checked out. Do not deal with shortness of breath or chest pain for days and days and days. Get that checked out. Also, consider that, if you come to the ER with chest pain, we are going to evaluate you for cardiac disease. Hey cousin, hey Dr. Ken, hey cousin Stanley, thank you guys so much for coming in. So, if you come in complaining of chest pain or shortness of breath, we are going to consider whether or not this is a heart attack. And we're going to look at various risk factors, things like that. The major cardiac risk factors being hypertension, diabetes, high cholesterol, a family history, meaning having an immediate relative who's had a heart attack or diagnosed coronary artery disease under the age of 60. And then, like, if you have a personal history of heart disease, those are cardiac risk factors. Obesity isn't one of the 5 cardinal ones, but that's also a cardiac risk factor as well. Oh yes, and cocaine use, definitely, Dr. Ken. Thank you so much. And Dr. Ken and I are going to be doing a Facebook Live on Sunday at 2 p.m. Central Time on anxiety. And that is the reference to number 5, lesson number 5. You could be having chest pain due to a heart attack, or it could be anxiety. We're going to look at all the life-threatening causes of chest pain, and if we rule those things out, it just might be anxiety. And we're going to talk about the mental and physical manifestations of anxiety in 2 days at 2 p.m. Dr. Ken is a board-certified psychiatrist, Air Force veteran, and corporate leadership coach who definitely has years and years of inpatient and outpatient experience treating psychiatric conditions. So we're going to talk about that on Sunday. So thanks so much, Dr. Ken. I'm looking forward to our session also, because there is so much anxiety that comes to the ER masquerading as, possible coronary artery disease, a possible surgical abdomen, a possible allergic reaction, possible migraine, and all of those things could easily be anxiety. So we have a lot to talk about on Sunday. So lessons from my last shift: don't let the toddlers get playful with the dogs at feed time. Don't work on sharp, heavy objects or objects that can break into sharp pieces unless you're wearing closed-toed shoes. Okay? Number 3, if you are engaging in horseplay or an actual physical altercation with someone, you shouldn't be doing that, but if you are, if they show the willingness to bite you, to pierce your skin with their teeth, disengage. It's not worth it. It is not worth it. Okay? And let's see, what was the other? So don't let the little ones near the dogs. Don't do work with sharp or heavy machinery barefoot. Don't let people bite you. Okay, and what was number 4, guys? Yeah, we'll definitely tag you. Is it Ramisha? I like Ramisha. I really like that name. So let's see. And number 4 was, if you suffer an injury to your hand, if you accidentally slam your hand in the car door, if you are using a hammer or something like that and you accidentally strike your hand, know that it could swell. So remove all rings immediately. Remove all rings immediately, because as soon as you get to the ER with that swollen, blue, cold, numb, tingling finger, we are sawing that ring off. That ring is toast. So remove the ring should you suffer any kind of crush injury to the hand. And lesson number 5 is know that anxiety, and there is more anxiety than ever given this pandemic and our political situation and the other tensions going on with us right now. Anxiety can manifest itself in any number of ways, and an ER doctor, this ER doctor, and the psychiatrist, board-certified psychiatrist, that is Dr. Ken, we will be discussing that on Saturday, and we want you to share your experiences. Tell us what symptoms that you might have had that ended up being anxiety, and definitely share that discussion, because anxiety is so very common amongst us, especially now. But thank you so much for joining me tonight on a Friday night. I'm Dr. Kadisha, your board-certified emergency medicine physician, concierge physician, author of the best-selling book, Help Us Help You in the Emergency Room. You can go to my website, www.drkadishamd.com, and get any of these things. And follow me definitely on Instagram at dr_Kadisha_MD. And stay tuned for other news about the special event that I'm having on Thursday, July 30th at 12 p.m. Central Time to launch my new product of which you might already be aware, one that was expressly made for these times. So thank you so much again. I really appreciate you guys. Definitely share this discussion. Let's stay out of the ER this weekend. Who wants to be in there worried about if you're going to catch COVID? Let's stay out of the ER this weekend. Be safe, be successful, and I will see you definitely on Sunday. Bye.